Welcome to the ICD-10-CM update for April 1st, 2024. I'm Kim Graham, and I'm so excited to bring you this alongside Lynn Keene. Our objectives for this course are I will help you locate and download the 2024 ICD-10-CM files for April 1st on the CDC website. We'll demonstrate the use of new or changed index entries and excludes notes in ICD-10-CM for 2024, and also we'll identify and apply the 2024 ICD-10-CM guideline changes. So let's get started. As you begin, you should download the April 1st, 2024 ICD-10-CM code tables and index files from the CDC using the URL provided here. This is a little different than in the past. Normally we're downloaded from the CMS website, but at the time of this recording the files were not available there, so I'm going to show you how to get to the ones on the CDC site. Once you get there, you're going to click on the ICD-10-CM table and index April 2024, and this is a zip file. You'll want to click to open the zip file, and then you'll locate there's 5 PDF files there. They all have red icons. You're only going to need 2 of those this time because there are no changes to the drug, the external cause, or neoplasm tables for April 1st. Once you click on these files and open them, I would save them to your desktop or other convenient location, and also consider renaming them to, say, April 1st, 2024, to differentiate them from your October 1st, 2024 files. You'll use these files until your encoder is updated with the code set after April 1st. You don't want to print these files. They're huge and they're best used electronically. You're also going to want to click on the 2024 ICD-10-CM guidelines from the same URL above. Save this file to your desktop or other convenient location. Again, consider renaming the file to something like April 1st, 2024 guidelines to differentiate those from the guidelines you'll use up until the end of March. Be sure to watch the video on the next page to see how this works. To locate the files, you can click on the link that's provided above this video. Typically we're going to the CMS website for our files, but at the time of recording they are not on the CMS website yet, so we can get them from the cdc.gov website. You'll see there are 4 different files here. We are going to download the guidelines, the addenda, and the table and index. So if you click on the guidelines, they will open up. You can save them to your desktop or another convenient location. I also recommend renaming them to April 1st, 2024 guidelines, so you're not confusing them with the current guidelines that you're using until the end of March. If we arrow back, we can click on the addenda files, and that's going to download to a zip file, so we're going to want to open that up, and you can see there are 5 files in here. I've done the heavy lifting for you, and we only need to download 2 of these. So we're going to download the index and the tabular. There were no changes in the drug, the external cause index, or the neoplasms. So if we go here and click on the index, it will open up the index, and you will be able to scroll through, see the changes that have been made for April 1st. You can save this to your computer, and again, be sure to name it April 1st, 2024. If we go back to our zip file, to the tabular, we want to double click on that and open it. It will show you the tabular, and you can scroll through and see the changes that were made. Again, you can save this on your computer or convenient location. Now we can close this zip file, and go back to our original list, and we're going to now click on the table and index, which again is going to open a zip file. The only files that we're interested in are these PDF files, but again, already knowing what we know, there are no changes in the drug, the external cause index, and the neoplasm. So we're going to download the index as well as the tabular. So if we click on the index, double click on the index, it will open up. Again, you can save this to your desktop, renaming it to April 1st, 2024. If we go back, we can then double click on the tabular file and open that up. And again, you can save this to your desktop so you have this ready for April 1st until your encoder is updated. For the April 1st, 2024 changes, we have no new codes this time. We have 3 changes to our official coding guidelines relating to sepsis due to a post-procedural infection, diabetes, and aftercare. We also have several Excludes 1 notes that are changed to Excludes 2 notes. We'll be sure to review all those. And lastly, we have several index entry updates. Mpox is the updated terminology for monkeypox. And so our coding system has now included that term at BO4 under monkeypox to say that if Mpox is documented, we're good. And also there's a new index entry for Mpox. Before we get started, I want to provide some definitions of some of the types of notes we're going to see in our examples coming up. Certain conditions have both an underlying etiology and multiple body system manifestations due to that underlying etiology. And for those conditions, ICD-10-CM has the coding convention that requires the underlying condition be sequenced first, followed by the manifestation. And whenever we have combinations like this, there's a use additional code note at the etiology code and a code first note at the manifestation code. And these instructional notes give us the proper sequencing order of the codes, which is the etiology followed by the manifestation. In addition to the notes in the tabular list, these conditions also have a specific alphabetic index entry structure. And that is both conditions are listed together with the etiology code first, followed by the manifestation codes in brackets. And a good thing to remember is that the code in brackets is always sequenced second. An Excludes 1 note means it's not coded here. It indicates that the code excluded should never be used at the same time as the code above the Excludes 1 note. And this is used when 2 conditions cannot occur together, such as a congenital form versus an acquired form of the same condition. There is an exception, and that's when we have the circumstance where 2 conditions are unrelated to each other. An Excludes 2 note represents it's not included here. So the condition excluded is not part of the condition represented by the code, so a patient could have both conditions at the same time. When an Excludes 2 note appears under a code, it is acceptable to use both the code and the excluded code together based on your documentation. A use additional code note has been changed to a code first note at E89.1, post-procedural hypoinsulinemia. The code for other specified diabetes mellitus from category E13, which identifies diagnoses such as post-pancreatectomy or post-procedural diabetes, must be sequenced first. A note here that depending on what your principal diagnosis is, this could have an effect on your DRG. So the code first note says, if applicable, you'll code that diabetes code first. Keep that in mind. Pay attention to your documentation. If you do code the E13 code as your principal diagnosis, your DRG is going to be 639, which is diabetes without an MCC or CC. However, if we use the E89.1 as our principal diagnosis, the DRG is going to be 641, which is miscellaneous disorder of nutrition, metabolism, fluids, and electrolytes without MCC. We have an index entry update for the diagnosis of central nervous system depression. That diagnosis is now going to be routed to code G98.8, which is other disorders of the nervous system, falling under the nervous system chapter, whereas previously it indexed to code R09.2, which is a symptom code of respiratory arrest. And you can see that it fits better under the nervous system chapter. The central nervous system depression is not really a symptom. It's a physiological state that can result in a decreased rate of breathing, decreased heart rate, and loss of consciousness, possibly leading to coma or death. At I-49, the Excludes 1 note has been changed to an Excludes 2 note, allowing codes from category I-49, other cardiac arrhythmias, to be coded along with bradycardia when documented with several different terms such as sinoatrial, sinus, and vagal bradycardia. At category J12 for viral pneumonia, the Excludes 1 note has changed to an Excludes 2 note for many other types of pneumonia that may be documented along with the viral pneumonia. Remember that the Excludes 2 note says that the condition excluded is not part of the condition represented by the code, but a patient may have both conditions at the same time. At J18.0, bronchopneumonia, unspecified organism, the code in the Excludes 2 note for chronic bronchiolitis has been corrected to read J44.89. And then we also have an addition for the diagnostic statement of other specified chronic obstructive pulmonary disease, which codes to J44.89. Both of these codes, well, the chronic bronchiolitis previously was instructed to go to J44.9, which is COPD unspecified. So here we have a more specific code for that diagnosis. The index entries have also been changed to identify code J44.89 as the correct code. Similar changes have been made at category J45, asthma. All of the cross-reference codes in the Excludes 2 note have been changed to read J44.89, other specific COPD. An addition was also made for the diagnostic statement of other specified COPD, which codes to J44.89. Previously, the codes were instructed to go to J44.9, which was the unspecified COPD. So again, here we have more specific codes. At code K66.0, peritoneal adhesions, post-procedural or post-infection, the Excludes 1 note has been changed to an Excludes 2 note. Now, both female pelvic adhesions and female pelvic post-procedural adhesions can be coded along with peritoneal adhesions. A new index entry for calculus, calculi, calculus, biliary with bile duct involvement has been added and says to see also calculus bile duct to determine the correct code. There are new index entries under calculus for the presence of a stone in the urinary system. All 6 new entries identify that when the stone is associated with hydronephrosis, only the hydronephrosis is coded, and when the stone is associated with both hydronephrosis and infection, only the infection is coded. This is now consistent with other indexing. Just a note that when you look under the code N13.6, it says that it pertains to conditions in N13.0 to N13.5 with infection. And also there's a use additional code note that you would want to identify the infectious agent if documented. At category O85, puerperal sepsis, 2 entries in the Excludes 1 note have been changed to the Excludes 2 note. These are general tract infection following delivery, code O86.1, and urinary tract infection following delivery, code O86.2. The entry for sepsis during labor has just been alphabetized correctly with these other changes added in. The feeling of foreign body in the throat diagnosis got a new code in October 2023, R09.A2, and the index entry has now been updated for April 1st. Currently, the index entry still points to R09.89, which is other specified symptoms and signs involving the circulatory and respiratory systems. So you can see they've updated this code to be very specific. At code R68.2, dry mouth unspecified, one of the entries in the Excludes 1 note have been changed to an Excludes 2 note. Salivary gland hyposecretion, code K11.7, can now be coded along with dry mouth, meaning dry mouth is not exclusively a symptom of salivary gland hyposecretion. There could be other reasons for the dry mouth. So if documentation supports, we can code these two codes together. At subcategory Z59.1, inadequate housing, the Excludes 1 note has been changed to an Excludes 2 note for documentation of problems related to the natural and physical environment, coded in subcategory Z77.1. Now that we've covered the changes to the index and tabular, some Excludes 1 and 2 notes, we're going to change our focus and look at the guideline updates for April 1st, 2024. 2 additional codes have been added to this guideline that identifies sequencing for sepsis due to a post-procedural infection. T81.49, infection following a procedure, other surgical site, and O86.09, infection of obstetric surgical wound, other surgical site, should be sequenced first because they identify the infection, even though the codes are somewhat generic. But they do allow us options for other surgical site when we don't have a code to go for the specific site. This guideline change now identifies the appropriate sequencing of the codes for secondary diabetes mellitus due to pancreatectomy. A code from category E13 is sequenced as the principal or first listed code, and both codes E89.1 for the post-procedural hypoinsulinemia and a code from subcategory Z90.41 for acquired absence of the pancreas are both coded as additional codes. That category Z90.41 identifies whether this is a partial or total absence of the pancreas. There is a single word changed in this guideline that changes the meaning. The word chiefly has replaced the previous word of solely. This allows the aftercare encounter to include more than just radiation, chemotherapy, or immunotherapy.